Hello everybody, and welcome to Species Specifics. Today we're going to be discussing rabbits. If you are new to this series, the goal of these lectures is to cover unique diseases of different veterinary species that are specifically mentioned in the ICVA NAVLE study guide. I've also included some diseases that are not specifically mentioned, but may still come up. The focus of these lectures is on disease recognition through images, clinical signs, and diagnostic tests. I've also highlighted key, easily recognizable characteristics in bold. We will start by looking at some digestive disorders of rabbits. Rabbits can get both hepatic and enteric coccidial infections. Most of these infections are subclinical, but you may see poor growth in young rabbits. We typically treat affected rabbits using coccidiostat medications. Prevention of the hepatic form involves improving sanitation in the environment. However, the intestinal form can occur even in the cleanest of rabbit environments. Dental malocclusions are common in rabbits due to their continuously growing teeth. Animals who consume an exclusively pelleted diet may also be predisposed. Clinical signs include drooling, teeth grinding, and anorexia. We can treat this condition by trimming the teeth under anesthesia or potentially removal of affected teeth. Gastrointestinal stasis is a somewhat unique condition to rabbits that is typically associated with stress or pain. Clinical signs include decreased food intake, inactivity, and pasty feces. Treatment involves supportive care, including assisted feeding to help the intestinal tract resume motility. Preventative measures include feeding a high-fiber diet and avoiding stress. Mucoid enteritis is another unique condition to rabbits. We don't know the exact cause of this condition, but it may be related to diet changes or low-fiber diets. Clinical signs include gelatinous or mucus-covered feces, a rough hair coat, and a bloated abdomen. Treatment involves supportive care. However, this condition typically has a very poor prognosis. Finally, we have enterotoxemia. This is caused by Clostridium spiriforme. Low-fiber diets or the use of antibiotics are common risk factors for this condition. Clinical signs include green to brown fecal staining, but many rabbits present with sudden death. If diagnosed before death, fluid therapy and supportive care are the main treatments. Next, we will look at some skin diseases. Moist dermatitis is a condition where the dewlap, which is a heavy fold of skin in female rabbits, becomes wet and infected. Usually the dewlap gets wet during drinking, and the constant exposure to moisture leads to inflammation. Clinical signs include dermatitis and hair loss. Preventative measures include using drinking valves instead of dishes to help prevent the dewlap from getting wet. Otoacariasis results from infection with Psoroptes cuniculi. This is a mite that is transmitted by direct contact between rabbits. Clinical signs include thick brown crusts in the ears and scratching or itching at the ears. In some cases, the infection may invade the inner ear and cause CNS signs. Treatment involves antiparasitic medications. The most common species of fur mite in rabbits is Chyletiella, which is also called walking dandruff. Most rabbits are asymptomatic, but it may cause mild dermatitis on both the rabbit and on people who are handling that rabbit. Owners may also see walking dandruff. Treatment involves dusting the rabbit with permethrin powder to help kill the mites. Finally, we have pododermatitis or sore hocks. This condition usually results from weight bearing on a wire-floored cage or injury to the skin during stamping. Clinical signs include tiptoeing while walking and dermatitis lesions on the feet. Treatment focuses on antibiotics and preventing further irritation by changing the flooring type. Next, we will look at two reproductive diseases. Uterine adenocarcinomas are the most common tumor in rabbits. Up to 60% of intact does over 3 years old are going to develop this tumor. It also frequently metastasizes to the other organs, giving it a pretty poor prognosis. Clinical signs of a developing tumor include vaginal discharge and decreased fertility. Prevention focuses on spaying non-breeding females before they develop the tumor. Treponematosis in rabbits is caused by Treponema periluis cuniculi. This infection is transmitted during breeding or from does to their offspring. Clinical signs include scabbing of the genital region, lips, and eyelids. We can use antibiotics to try and eradicate the disease within a breeding colony. Now we will look at some other infectious diseases affecting rabbits. Pasteurellosis is an extremely common bacterial infection in rabbits and is typically transmitted by direct contact. Most rabbits carrying Pasteurella are asymptomatic. Pasteurella infections, when Pasteurella infections are clinical, they can cause a wide range of conditions including rhinitis, pneumonia, abscesses, otitis media, and septicemia. Antibiotics may help control clinical signs in rabbits that do develop clinical infections. Tularemia is most common in wild rabbits. This is a reportable disease caused by the bacterium Francisella tularensis. It causes acute fatal septicemia in rabbits, and classic findings on postmortem include multifocal areas of necrosis, particularly in the liver and spleen. Treatment is not indicated for rabbits with this condition. Tizer's disease is caused by Clostridium piliforme and primarily affects young rabbits. Clinical signs include profuse watery diarrhea that rapidly progresses to death. Antibiotics may be helpful at limiting an outbreak within a rabbit colony. Owners also need to disinfect and decontaminate the rabbit's environment thoroughly. Encephalitozoanosis in rabbits is caused by encephalitozoan cuniculi. This infection is widespread in rabbits, with studies showing that up to 75% of rabbits may be affected. However, most of these infections are subclinical. If clinical signs develop, you can see a variety of symptoms depending on which organ is affected. Common findings include head tilt, urinary incontinence, uveitis, and weight loss. The main treatment used is fenbendazole. Rabbit hemorrhagic disease is a reportable disease caused by a highly infectious calicivirus. It primarily affects European rabbit species. Clinical signs include fever and sudden death, and at postmortem you will see hemorrhages affecting multiple organs. This disease has a very high mortality rate and usually results in death or euthanasia. Myxomatosis is a fatal viral disease of rabbits that is sometimes called big head. The virus is transmitted by direct contact and through insect bites. Clinical signs include a swollen, edematous head, nasal discharge, and death. There is no effective treatment for this condition, so euthanasia is recommended for these rabbits. Shope papillomavirus is a viral infection that primarily affects cottontails. It is thought to be transmitted by insects. Clinical signs include papillomas on the legs, feet, and ears that often regress over time. Treatment is not usually necessary unless it affects daily activities. As a fun fact, this virus is believed to be the origin of the jackalope myth, which is the rabbit with antlers or horns. Rabbit oral papillomavirus is a related virus that primarily occurs in domestic rabbit species. It causes white pedunculated nodules or warts on the tongue or on the floor of the mouth. These lesions also regress over time in most cases. Again, treatment is not usually indicated unless the lesions are bothering the rabbit. Lastly, we have a couple of non-infectious diseases to review. Fractured spines are common in rabbits due to the strong kicking power of their hind limbs. Usually these spine fractures occur due to improper restraint or improper handling. Clinical signs include posterior paresis and urinary and fecal incontinence. Treatment involves supportive care, and some rabbits may have their clinical signs resolve over time. Splay leg is an inherited disorder affecting young rabbits. The condition can also be exacerbated by walking on slick flooring. The main clinical sign is abduction of one or more legs. Treatment involves bracing or splinting the legs to help them grow correctly. Finally, we have urolithiasis. This condition is common in pet rabbits, and the main risk factors are high dietary calcium and low water intake. The main clinical sign that we see is hematuria. Treatment involves surgical removal and diet changes to help prevent recurrence. Thank you for watching Species Specifics. If you enjoyed this video, remember to like, subscribe, and share with your classmates. If you're feeling generous, there is also a link in the description where you can buy me a coffee to help fuel future video making. Thanks again for watching, and we will see you in the next video.